Your Town Matters is funded by the Government of Canada through the Local Journalism Initiative and supported by Cactus Media, Canada's independent community television association.
Welcome to Your Town Matters. I'm Natalie Sturgeon. In an effort to try and keep residents in St. Stephen as informed as possible, we've selected key topics we would discuss with any leader of the community, as we do with other mayors in the region. On this St. Stephen edition of Your Town Matters, we are taking a closer look at the discussion from the July 16th Committee of the Whole meeting. We begin this episode with an update on the Community Safety Survey. The Council conducted this survey in order to get a better grasp on the perception of community safety. It has been grappling with a rise in homelessness due to the ongoing housing crisis. Let's listen to the discussion on how it would like to move forward on creating a community wellness plan.
And looking at the next steps with that program, if committee and ultimately council decide to continue along working on those paths. Council received, we forwarded correspondence that we had received from the consulting firm that did the work as to some of the things they've done in other communities, as well as some next steps that were potentially as far as creating a full-on community wellness plan. We also, Celeste and I also participated in a webinar just the other day on a pilot project being put on through funding through the federal government. They're looking at they're calling it Project Upstream. They are looking at selecting 10 pilot sites from across the country in various sizes, various different types of municipalities, to look at how to bring resources to bear, basically as the project is called Upstream, before some of the issues happen, as what we've talked about, is getting the prevention in. So we spent a couple hours on a webinar about the application process for that. So we're going to stay in tune with that. But I guess really for us, it's just a matter of if there's a desire from the committee and ultimately council for us to continue putting staff resources into evaluating and walking down the next steps of the community wellness plan, planning, for lack of a better word, and bringing back a proposal and a budget to continue and enhance take the knowledge we've had for the survey and take it to the next step into a more community-built, community-driven plan for the medium long term as well, with actionable items. So that's why we wanted to bring it here for discussion, so we could get whatever direction that you saw fit.
Okay, any discussion? I'll just to bring up a councillor shared a story, a news article about the same type of study done in another municipality, and as we found out as well, is that the majority of the items are not in our mandate or our toolbox. So how would we tackle those items without, is that something you're going to do through my office and then I talk with the province or whoever is involved?
So a couple different approaches. The Project Upstream, if we apply for that and happen to be successful, basically it's doing a lot of what I've been doing over the last couple of weeks locally. It's coordinating a number of agencies who have expertise across the spectrum of the social services work to create plans and action items specific to each community. And really the pilot project is how do we get all these different agencies, especially the large national ones, to have great expertise and great knowledge to down into the grassroots level of especially small communities that don't have the resources internally that big cities might have to try and combat some of these and mitigate some of the impacts. So through that project, there's a pre-established working group that comes to bear. From the community, just if we did just locally, I think it's the meeting that I'm myself and Mr. St. Ange from the government of Brunswick are setting up to bring all the players into one room and have a conversation is a first step to creating that type of plan. And if we had also had the consulting firm like we used for the survey also in that room to help coordinate and help create the matrix of who does what, who has what mandate, and who has what resources to bring. I think that would be the way that we would do that. We would be the coordinating effort and the voice of the community in the ears of the right people that are around the table trying to figure out how to make things work better than they do currently. So it's not it wouldn't be necessarily municipal dollars going in as much as staff time, political time to be that voice and be that champion. And doing the coordinating efforts for various meetings and maybe some hosting some meetings in the GCC type approach. So that's kind of where the vision is right now, if we were to continue walking down this path.
Well, so I actually support us move forward and continue down this path, because if we don't, no one's going to do it. So we at least got to get the paddle in the right direction anyway. Councillor Wright?
Thank you, Mayor. Yes, I was just going to say the same thing, that we found out the bulk of it. We can be advocates for it, but they're not in our capacity as a municipality, budget-wise, and they're certainly not in our mandate. But even if we wanted to assume them as a mandate, the cost to the municipality would be astronomical. So if we can continue with the understanding that what lands in our lap for what we do is what stuff we actually have control of, which is advocacy and petitioning the various levels of government, but that we're only held responsible for the things we actually have control over. Because when you do a plan, and I've read some of the plans that group has done for other municipalities, and the same challenge applies. The plan says the community needs this, but it doesn't delineate what the community itself actually has the mandate and the capability of doing, versus separating from the other levels of government. And when you take a project on and you say this is ours, well, then you own the outcome. And so if we have a plan that 80% of it belongs to somebody else, but we've owned it, then we take the blame for when it fails, if it fails, because we didn't get the resources we needed from other levels. So if that focus can be maintained, I'm fully supportive of moving ahead with something, but I just don't want us saying, okay, this is our plan, when the bulk of it is stuff we really have no control over other than advocating. So I would like to ensure that focus is there, so that when the plan either works or doesn't work, we're responsible for only what we're responsible for, I guess. That's what I'd like to say.
Sure.
Yeah, and I think in my conversations with the consultant on this, they work nationally, and different provinces, municipalities have different requirements for the social services, and so it's making sure we match up the legislative framework of New Brunswick, which is essentially we have no authority at this point for a lot of these things, to the realities, right, and to the plan. I think the one advantage we have sitting here today is that, for many reasons, the work of His Worship, the work of this council, the work of my team, the work of our MLA, is we are on the radar. We are on the radar of GNB when it comes to some of the social issues that we're having right now, and the need to mitigate some of the negative impacts. Many communities across Canada can't get that attention, and we have it right now. So I think, as long, keeping in mind our role and what we should be doing, I think we have an opportunity to strike while the iron's hot on these issues. We have Mr. St. Ange and Deputy Minister Meehan, who have been very supportive and very engaged with the mayor and I and others. So we got the right people listening. We're working on bringing all the service providers together who want to do something unique, that want to have something to be proud of, a plan to be proud of. So I think this is our opportunity, and I would hate to see us miss it just because we're overly concerned about, you know, whether it's ends up being a few $1,000s in meeting fees or whatever. I think we need to definitely take the opportunity and put the resources into giving it the best shot it has to work. That's where I'm coming from on it, where my team's coming from on it. So we just want to make sure that we were aligned with those of you who have the power to tell us what to do.
So yeah, and I'll add to that. Whether we spend $2,000 on some administrative work for you, or we spend $100,000 on reacting to the issue that we're dealing with. So it's just the reality that we're in, and you're right. We are a collective voice, and even the province needs a collective voice. So we're their collective voice. So you're right. It is definitely beneficial to do. I would like to make sure we do keep track of who's got the ball, so to speak, and who's, you know, in a scorecard of success or whatever, or where we're going, so we can keep an eye on it and help push it along too.
The council also provided a healthcare update as it works to improve access to primary care in the region. St. Stephen is one of the areas promised to have a collaborative care clinic in the first 18 months of the mandate of a new Liberal government. The update included that Horizon Health had acquired 1 respiratory therapist, 1 social worker, and 2 primary care providers.
At the last meeting, I told people that we were getting a new doctor, right? And I said, make sure that you're on the New Brunswick Health link, or you go through 811. We got 1 doctor, and we have like 6,000 people on the link, right? I thought, okay, that's a little that's a little difficult. And thinking if we were going to take on everybody, we'd have to get quite a number of doctors. But since then, we've gotten some information on what it is that the province wants to do. And that is included in your package, okay? So they gave a really nice update. So right now, if you need to see a doctor and you don't have one, you could call the hospital and ask them for the wellness clinic or a doctor. And I know different people have called me and they say they're having a hard time getting in. But if it's urgent and you need to have it looked after, then you can go to outpatient, right? Anyway, and then a little while after, we met with Minister Dornan, and he said, he was talking to us about the family health team that they're building, and this is what they want to do for the whole province. And he said, rather than being attached to a doctor, you would be attached to a clinic, right, to the health team. So he said, anyway, we're hoping by 2029 that we'll have everybody in New Brunswick attached. So you could see the look on people's face. This 2029 is not going to be, but I've given it a lot of thought, and then right now, like in our region, they've welcomed a couple of professionals. For example, they have a social worker and respiratory therapist, and these people, you do not need a referral to go see them, so you would just call the clinic if you need to see those. We've also, our new doctor is here, and things are working very well, and we're going to work on getting more doctors. So what they're going to do is build the teams, and then hopefully we can have the clinic. So really by 2029 we'll have our clinic, we'll have the whole team, and we'll be good to go. And when I was looking at the information too, like they have an example of who they could have on the clinic. And I remember one time going to see the doctor with my husband, who's diabetic. Anyway, she had to set up an appointment with a diabetic person, right? So if you go to a doctor, they're going to have to look for somebody. But this way, then you have the whole team. And also, they're going to be working with people that are already here. Like we have doctors that have their own practices, and they're going to get them involved with the clinic. They might work in their own building, but they would be involved with the clinic. And I know it's kind of a hard thing to put in your mind. Like, I mean, you know, like when I was young and I got a doctor and I kept the doctor like basically up to now, right? But the doctors all seemed to be retiring at the same time, so then they were gone. And also, like if you look at new doctors coming in, they come out of medical school, they have, like somebody said, something like $400,000 worth of debts. And are they going to want to come into a community and set up a practice, right? Plus have 3,000 patients and last for the whole time. So I think this is more attractive to people. And there were a couple, the session that Councillor Rodas and I went to, there was an older physician, and he said, you know, most of my patients are about my age and they need a lot of care, and I'd like to start phasing out. So he said, I'd be quite willing to work in a clinic for a day a week or 2 days a week. So it's a lot more attractive for younger people and older people, and hopefully by 2029 everyone will be attached. Now, and I'm saying this right now, if anybody wants to call me and talk about it, we can. When I'm on here, it's difficult to explain, but when I have a conversation, people can ask questions, and it's hard to explain sometimes to make people understand what's going on. And I know if you're sick and you need a doctor, you'd like to have one now. Okay, thank you.
Councillor Rodas?
Yeah, I think, and maybe we could do even, Deputy Mayor Wheaton and I could do like a little coffee house here one day where people can come in and just ask us questions about the primary health team model. But it sounded like, from what Minister Dornan said, just because if the shovel may go in the ground far before 2029, but their ultimate goal for the whole province is that by 2029, nobody will be unattached, period. So that means that you will have consistent access to care no matter what. That means if your doctor's on vacation, or your primary physician that you see, there's somebody there in their place. If you need a social worker, an RT, a physio, you have consistent access. If you need to just be able to call, telehealth, and get answers to questions, you'll be able to have access. So on this photo, I'll actually probably share this on social media and maybe give it to the town too to share, but it says healthy homes, healthy neighborhoods, and healthy communities. So it's kind of branching out to make sure that you access the care at the right place, and that way physicians can actually focus on just physician roles. And so that means when you have an emergency, you go to the ER. But it's kind of the same as registering for this clinic. Like if it's an emergency, like if you feel that you have been having a consistent cough for 8 months, please go to the ER and just have them order a CT scan and maybe go in our new machine. Like I don't want people waiting to, if they have something going on right now that they've noticed for months, don't wait to go to the primary health clinic, right? We want you to go to the ER for those things. But if you have to call every day, all day, if you can be patient and you can get through it, we have had many successes. It's just they're trying to figure things out. And then over time, they will continue to add physicians. When you go to the 3rd floor, you may not see Dr. Saber. It could be another physician. So people are being very confused by that already. They've gone and they've seen maybe Dr. K or Dr. Atchison or another local physician. But that's because everyone is jumping on board to this primary model. So they're rotating through all the time, but there's an electronic health record and all of the information is able to be accessed. As far as Dr. Saber, his wife Amel is also a physician, which is wonderful news. She is working with the college to try to obtain her license as well. Deputy Mayor Wheaton and I have spent, I feel like every other day we're with the family. We've been going on walks. We connected them to sports, soccer, basketball. We talked with the high school principal about doing a tour. We obviously secured the rental through the RSC for July and August, and now we've secured them a longer term rental for the whole school year, so they have time to just settle in. So if they want to purchase, they have time to do that, and they've been connected with Jeff as well. So that could potentially be 2 physicians. So if you meet them in community, I've noticed people stopping by their house and saying, welcome, hi, how are you? Just remember they're also citizens, so treat them as such. Don't hop into the physician problems right away, but just give them a warm welcome to the community. And they have kids in elementary, middle, and high school, so I'm sure you'll be seeing more of them.
Okay, so thank you for that update. I appreciate your work on that file. And I also want to, I want to let Councillor Harding speak, is what I want to do. Go ahead.
Thank you. Now, a couple of things. First of all, we're still going to have outpatient here, correct? In the Charlotte County Hospital, because I find that the outpatient here is wonderful. Last August, I broke my wrist, and they put it back together there. Yeah, it's not great, but it will do. But I just find that they're wonderful down there. So I wouldn't want to think. Then, I understand in 2029, we're going to have a new clinic? No? We're maybe having a new clinic, correct?
18 months.
Oh, in 18? Okay. Okay. Now, if we're going to... Okay, if we're going to have a new clinic, I would like to say that on one of the floors of the clinic, we should have some sort of rehab. I really believe that that's important. I am pretty well sick and tired of getting phone calls every other day about the shelter, and I think that people should be moved out of there and into some place where they can get some help. I don't think they're getting any help there. So is that in the works, that they might be looking at that, Mayor?
So as Jeff was talking about with St. Ange, and that's tied into that as well. So we're working on that meeting within a couple of weeks, actually. So yeah, so that's being discussed as well. And as for the clinic, it was told 18 months, so I'm still holding them to that. And on that note, I'd like to thank Rivers and Jeff and Alex for the work on the stuff I've been throwing at them a lot in the last few days or last few weeks. So thanks for all your efforts on that to get that shovel in the ground, so to speak, before 2029. Holy jumpins.
Lastly, the Council discussed a letter received by the St. Croix International Waterway Commission. Earlier this year, Councillor Brian Cornish brought up allegations of pollution. He described a brown substance that floats in the river and an odor. The Council wrote to the provincial government to request an investigation into that pollution, but it was told there wasn't any evidence of it, describing concerns raised by residents and Council as anecdotal in a letter. Cornish also presented at a recent meeting of the Commission, which has formed a subcommittee.
About a month ago, probably a month ago, the International St. Croix Watershed Board met actually here in this building, and they're basically represented both on the American and Canadian side at the highest level of the Water Commission on that river. And I was asked if I would attend that, and because I've been complaining about the water pollution, air pollution coming off the St. Croix River. And when I attended the meeting, in a sense, I apologized when I was able to speak. They did give a very, very good report on different things, the flow of the river, the use of the dams, et cetera, et cetera. But at the end of it, there was no mechanism in place to look after pollution whatsoever. So when I was there, I basically apologized in advance that I was not happy with one portion of that report, and that is pollution. And it was taken very seriously. Actually, the room went totally quiet. And after that, I felt that I would have to go after these people again, but miracles do happen, I guess. I was approached coming out of the meeting by one of the representatives and passed this book, which was good. And I also was talked to several other individuals as I came back to the council chamber to give my report. And that was it. And then this week, Jeff Renault sent us an answer from that they wrote a letter to the council, basically saying in very short words that they're setting up a subcommittee look on the pollution of the St. Croix River, and I'm very optimistic, and I'm very, pumped, because, and I'm looking at Marg here right now, because we sort of started this thing probably 6 months ago with the smells and the brown stuff in the water, and now they are going to appoint a subcommittee, so I'll keep an eye on it, and for the town itself, and I'm very pleased that a lot of people have been asking about it, and I'm pleased it's on the board here tonight that we can actually say that there appears to be movement to do something with that. So that's it. And simple, we'll just keep an eye on it, and it did reach the highest plateau in the river board, you might say. So anyway, thanks for everybody's support, and Marg, thank you for your support also.
In order to fit as much as we could into this 30-minute program, we did edit for time. For the complete meeting, you can watch it on our YouTube channel. Thanks for watching Your Town Matters. I'm Natalie Sturgeon.